Dear friends, welcome back. We are here today at day two of Pharma Circuit Conference with a very interesting speaker, Sridhar Balasubramanian. And Sridhar, is my old colleague from Dr. Reddy's. I know him for 15 plus years. And today he will be presenting a great topic on digital transformation, impact of COVID, and increasing compliance. Now, as you might know him from LinkedIn and from your network, Sridhar already needs no introduction, but just for the conference, I have to introduce him. He is, of course, having 25 years of experience in pharmaceutical management with quality and operations in a highly regulated environment for all the high volume, multiple doses forms and products. He has experience in corporate development, internal external quality management, and have led several regulatory inspections of US FDA, MHRA, MCCTGA, and Visa. He's a seasoned quality personnel, and I personally have learned from him a lot. So I'm glad that he is there today. Thank you, Sridhar, for being there. And without any further ado, I would hand it over to you and to all our audience for your speech. So please, the mic is all yours. Stage is all yours.
Wonderful. Thank you so much, Kuntal, for your introduction and the kind words. I, I, I believe I try to do some justice to this discussion topic of today. And I want to touch upon, you know, the essentially the Indian scenario when COVID hit us and what we did and how things have to transform for the future. So, what I'm going to share with you are some of the experiences as well. I used to be the head of quality for Biocon just when the COVID situation came into the country, and there were a lot of you know difficult situations within the organizations, not only ours but also many other organizations within India that faced tremendous challenges, right? When we were trying to manage the COVID situation on hand. So just a little bit few experiences, but I would like to first start with quickly saying about something about how the pharma industry is kind of working within the operating landscape here in India. So most of the pharmaceutical companies are largely dependent on manual operations, and we also know, all of us know, that pharma manufacturing is not so automated or robotized as, let's say, manufacturing of a car, or the assembly line of a car manufacturing unit, but it's largely dependent on stage-wise operations for manufacture of either API or formulations. And it is quite a manual, or let's say labor intensive kind of activity that we largely see within the pharma industry. Therefore, now we are highly dependent on humans for execution of manufacturing or the major activity of quality control. And typically our typical environment within the pharma industry is generally low on automation and digitalization. And why is that so? Is because we might be using equipment that have certain capabilities and cannot be automated, right? It can have some sort of automation to some extent, but it cannot be something like fully automated. And about 70% of all manufacturing units that we have only some sort of digitalization, and that too very pocketed in functions like quality control, where we see chromatography data systems, maybe some little more enhancements from a digitalization perspective, more to drive from a compliance level perspective rather than an operational efficiency management perspective. And almost just less than 10% of all manufacturing units have any such online systems like QMS, MES, LIMS, etc., that actually are operating to support the personnel for what they are required to do in terms of their activities that are required to be executed. So this is a typical landscape, and I think all of us would be familiar with such landscapes, and we might be working in those kind of environments. And nobody ever expected something like COVID would happen. When COVID came into the world, we started seeing some of this happening in China in December of 2019, and slowly it started to spread across the globe. And lo and behold, when we see this happening across the globe, as well as when we found that there were a large number of cases, etc., that were happening within India, we found that when we see our environment, which is largely dependent on manual operations and low on operation, and when we had this lockdown that started in March last week of 2019, this was right after a local holiday. So almost many people within the companies actually took a break of 1 or 2 days and went to their native places or their hometowns to celebrate the local holiday. It also happened to be a very important festival for many people. It was kind of a new year, especially in the south of India. And so, what happened when the lockdown was announced? There were heavy restrictions on travel. So, therefore, people who went out of their work spot, city, or wherever they were located, as far as their work was regarded, they found that they could not come back to work. Right. So that became quite a bit of a challenge because travel was restricted to within the state or within certain pockets, but not necessarily people were able to travel freely across the different parts of the country. And in a sense, most of the activities within the entire country came to almost a standstill. Why do I say almost a standstill? Because, of course, a lot of essential services were still ongoing and when working for the benefit of people to survive in terms of food and other things. But all non essential activities came to a standstill. The pharma industry, however, was included as a part of essential services. So, having said that, pharma units were allowed to operate because people would need medication, people will need medicines, and therefore the government of India decided that the pharmaceutical manufacturing environment will not suffer with shutdowns and lockdowns. But they gave us restrictions. They said you cannot have more than 50% of the people within your environment. They put in regulations with respect to how you operate, what are the things that you need to have in terms of social distancing, and many different kind of control measures were asked to be exercised by companies like us. So we also found, as I said, people had difficulties to be available for work because they were not in their city as well, where the work spotted, thanks to that small local holiday that people went to their own native places. Now, having said this, we found that it became quite a bit of a challenge, and the kind of result or impact of that situation, especially in the first 3 months of April, May, and June of 2020, was actually a very crunch and difficult situation for us to even run normal operations. Of course, we couldn't run normal operations. We were heavily dependent on people, and we could mobilize only a certain portion of the population of our company to be able to continue the manufacturing operations and the quality control operations. Just to give you a small insight into this, with the first 2 or 3 weeks of April, we could mobilize less than 25 to 30% of our required number of resources to be able to operate our manufacturing units. And it could be only up to the end of June where we saw when some of the travel restrictions opened up, we found that we were able to up it to about 75%. So, which essentially meant people were coming back as well. Now, this dynamic state resulted in several difficulties for us to be able to plan what to do, right? So, planning of operations, what are we wanting to execute, how are we going to do it? All of these became a bit of a problem, and we obviously had to scale down the amount of operations that we would do. We would concentrate only on certain products that were critical to market. Where we were lucky, where we had built up inventory, we were not going to manufacture. So that was easy, right? But the difficulty really was keeping things on track, right? To ensure that we were able to comply not only to the social distancing norms at workplace that were instituted, but also to ensure that we were able to have GMP controls in place. So complete risk assessment had to be carried out. in order to identify what kind of control measures that we can execute, what kind of control measures that we normally would execute with a particular frequency, how we can probably defer that to some extent with a reasonable amount of risk that we would be able to manage. So we had to ensure that we had to comply to SOPs, our regulations, and we also were hit with this new fundamental phenomena of work from home policy. Now, in a complete manufacturing environment, work from home policies were difficult to actually institute, but to identify itself was quite a difficult task as well. We also did not have very good business contingency or continuity of planning, and we had associated risks. Now, as more people started coming in, we also had the risk that our own people within the factories, would get infected. And lo behold, this phenomena of what I described with one organization was not felt only in one, but across different and operating and saying that we are not going to shut down production. We need to continue our business. We need to have people to be available because we were still an industry that was in the benefit of mankind. And therefore, we had to live with certain risks. We knew that there were certain risks, but we also needed to have good mechanisms to be able to look at these risks and these challenges and ensure that we have certain plans in place to work with them. Now, what we found within this whole thing was that if we had a level of digitalization that had already been put in place, then there would have been several advantages. And the few companies that I spoke about, the less than 10%, where the digitalization had come to an advanced level, we found that those companies were operating at a much better efficiency and at a much better level of compliance, even though the resources were not fully available on site. And therefore, some of those advantages that that those companies were able to execute was that it was easier to segregate the resources for what was required on site to what was required off site. Non-manufacturing related functions were allowed to work from home much easily, like the regulatory affairs, maybe a few of the analytics people who are there, the software IT people, all finance. Some of these functions could work from home seamlessly, and manufacturing related functions could be more organized much more seamlessly to bring about the best efficiency, not only in terms about execution, but also in terms of not having to stop certain product manufacturing. Therefore, planning and execution was much easier. There were contingency plans that did not require much effort, excepting for the fact of arranging and organizing who would come into the plant, who would not come to the plant, when they would come based on the kind of activities that were being planned. Therefore, we found that operations in these companies were much more efficient, and most importantly, the GMP compliance was not disturbed. They didn't have to take any drastic measures to reorganize what their GMP scheduling and frequencies were. So, therefore, what would be the kind of learnings that we would see here? We need to remember that the COVID will continue to play a role in our lives for the next 3 to 5 years. It's not going to change so dramatically. And in a country like India, where you have a 1.3 billion population, to be able to get through the vaccination of all the people, of the entire population, is going to take quite a while. And with the rate at which we are doing our vaccinations, India is, of course, the fourth largest country, or the fourth, I would say, in number of vaccinations. India has actually reached, number four in terms of the number of vaccinations that have been done. Although India as a country started vaccinations quite late, maybe a month later than the US and UK and some other parts of Europe, but we still have been able to do a lot of vaccinations in quick time. But even this speed is not going to be enough to be able to vaccinate the entire population so soon and so fast. And if anybody had seen Dr. Fauci's discussions at the hearing that he presented, it's not the base virus that is causing havoc now. It's going to be the variants and the vaccines that may work against the variance or may not work against the variance is still some possibility that we have to live with. But since now we know and learned through this year what kind of pitfalls that can occur, we have this opportunity to be able to correct ourselves, reorganize ourselves a little bit, to be able to make sure that some situations like this, when it does arise, we are not caught on the wrong foot and we can quickly do some sort of management of our operations in a much more efficient manner. Over the past 9 months, most of the activities have come back to normal. But in the recent 2 weeks within India, we've seen a surge of cases, and people again talking about lockdown, talking about shutting down operations to some extent. So, what have we done, or what can be done through what we have gone through in the first 6 months to what it can be for the next 6 months? Is that we need to be able to develop an organizational wide business continuity plan, incorporate some of those contingency measures, evaluate some of the risks and mitigations, and ensure that these mitigation plans actually are more oriented towards being less dependent on resources that have to be on site rather than off site. So, therefore, what you essentially end up doing is having to go towards the opportunities which could be in investing in automation and digitalization. Now, when you say digitalization and automation, it's not something that is a journey that can be completed in 3 months. I'm going to bring in a software and put it in place and it's going to start and work. It's not going to happen so easily. So, therefore, organizations need to realize that through this pandemic, until the time this pandemic is actually over, we can't wait for those things to happen. We actually need to start investing in certain automation and digitalization tools, especially those tools that ensure operational efficiency, but also ensure compliance to a large extent. The thing that we miss out in many of these digitalization or the tools that are helping our organizations to build in operational efficiency is that some of the analytics that we need and robotic process automation that we need for better and efficient decision making is actually not there within those tools. And therefore, now we got to be juggling with multiple data points to be able to do that. So, how can we build a better, more robust digital landscape for our organizations to be able to come to a level of where a level or a situation as quickly as possible to come about, making sure that we don't run into some of those pitfalls that we have seen in the first 3 or 4 months of the lockdown. So I'll just give you a few examples to illustrate as to how these things can actually work. The MES and LIMS systems, which is for manufacturing and quality control operations, will assist with online documentation. So, as the analyst or the manufacturing chemist is manufacturing, all the records are already going in. You're able to record what are the things that have happened during the manufacturing or the testing of the batches. The advantage being that you have low on errors because once you try to do it, if you try to do an error, the system will correct you, and those kind of advantages you will gain from a compliance perspective. It also facilitates a review from being offsite and therefore ease of batches. So you have in a single place where you have both your operational efficiencies getting increased, but at the same time, your compliance and your data integrity issues are not surfacing. And therefore, some of the examples of these kind of systems are available. Similarly, a robust document management system will ensure that you have the data availability for regulatory submissions a much more easy and a seamless manner, and regulatory folks do not even sit at the site to do their regulatory submissions. And as we add more capabilities like analytics and business intelligence tools, it only helps us to make our monitoring mechanisms much more robust. And of course, we will be able to take much better quality and business decisions in order to see what we do. Now, have organizations actually started to look at this in a much more concrete manner rather than saying, oh my God, we have so much of investment to do. I will have so much of time to invest. I will need to spend a lot of energy and effort. Is it really worth it? Well, COVID is just a trigger point, right? For organizations that have probably resisted in moving towards this direction, COVID actually opens this window of saying, hey, you can do something about it. And if you do something about it, it'll protect you in the next long run. But if you don't do anything like this, then you will still face those same consequences that you would see in a pandemic like situation, whether it's COVID or not. We will be able to keep seeing some of these things that will continue to happen right over a period of time. The other objective that people need to have in mind is that we need to be able to increase our efficiency. We will be able to get better cost benefit. We will also be able to enhance our quality systems and standards and compliance to regulatory inspections by way of use of these tools. Now, all of us know, and many of us, I can also share with many of you, that there is no one tool that will give you everything, right? There is no single tool. So it's going to be a combination of different tools from maybe different suppliers or different vendors, different solution partners who will be able to build this, digital landscape for organizational working. The most important thing all of us will need to remember is that any of these tools, any of these mechanisms that you put in place is not going to take away the need for having to have people on site running the manufacturing operations, running the equipment or the instruments that are required for quality testing. But definitely, it will make a world of difference to those compliance issues and data integrity issues within the industry that we keep seeing on a regular basis, even from organizations who have actually hit it really well from a digitalization or from a compliance perspective. We keep seeing some of these examples of things not being managed completely and properly. What will not be taken away is one, the skill of the people who require to do the manufacturing operations and the intelligence of people who do the monitoring and review of the manufacturing and quality operations for essentially ensuring that there is a compliance and quality umbrella that's built into any of the products that are released to the market. So this is just a kind of, I wanted to share with you some of the experiences we have had and some of the great opportunities that are there for organizations to move from whatever stage we are today within the industry to move to the next orbit in terms of ensuring better compliances and better operational efficiency. Thank you. I think this was what I wanted to share, and I would be glad if there are any questions um, and if there's anything I can help people with.
Thank you, Sridhar. I think this is really a great presentation and quite apt for the pandemic times we are all in now. And I think, if I may say so, you have actually given us a glimpse of what has really happened, how all of us and most of us, like people went for their holidays, annual holidays in the new year, they got stuck. When they came back, it's of course a new world, for all of them. Not only the technological challenges, but also, other challenges. And this brings me to the question, so in terms of EU GMP inspections or USFD inspections, what do you think? What has really like changed right now? Is it like desktop audits uh, are mandatory, or you feel that the physical audits will be back very soon? How do you see this situation, going forward?
All right. So when it comes to regulatory inspections, especially in the Indian context, what has actually started to happen is that agencies like MHRA and the EU agencies have started to do desktops audits. While it's not very efficient, it's not very great. It works. It's really long and it's really difficult sometimes to manage some of these, remote inspections as they call it. However, I think the guidelines from MHRA are pretty clear in terms of how they will see and what they will see. But we also need to remember that all these inspectors are also constrained by the fact that they're not physically talking to you, right, face to face. And therefore there will be a lot of teething problems and challenges that will be there. And it could be that some of these inspections, as we start to see them happening, will actually become a little difficult, right, to manage. A face-to-face inspection can be much easier, probably, because you may be reading the body language of the inspector, not really knowing where he's going or how he is doing it in a remote inspection vis-a-vis a face-to-face inspection. The other point that I want to share with you is that very recently there have been two FDA inspections, on-site inspections, US FDA and in India. So which means the FDA is starting to come back slowly. But what does, I mean, these inspections that did take place were for specific products because these were products of shortage, and where the regulator had to come in to do the inspection physically rather than remotely to be able to clear the site for further supply. Now, did these inspections take place very well? The answer is we can keep it as 50-50 from that point of view. But then it was definitely shrouded with a little bit of skepticism on both the inspector's side as well as from the company that was facing the inspection. But also it meant that you might need to have a new way of working, right? But what we do believe, right, as
Correct.
independent observers within the industry, we do believe that the inspections will start. They will start soon. I suspect that by September, when most of the US folks have got themselves vaccinated, and you see a substantial portion of vaccinations already completed in India, we
Correct.
expect that the face to face inspections will start with renewed vigor between September to December.
Wow. No, I think this is really an important piece of advice for all our global audience who are there with us today, our 300 plus, participants, but mostly, I mean, I'm sure that people who will be watching your video later on and YouTube or, wherever they will hear you through this channel, this is an advice which people were looking for, Sridhar, really, because, I think initially I also thought, that it will be only, the lockdown will be only for few months, and then it got extended and then 1 year. And when you say September, October, I think that this is really a positive news for the industry, because I can more than agree with you that face to face audits are required, because it is not about quality, but it is also about integrity, how people react with each other.
Absolutely.
Wonderful, great presentation. Thank you once again, Sridhar, for coming today in our forum, Pharma Circuit, and we would be really privileged to have you again in near future. Thank you so much.
And thank you so much, Kuntal. Thank you, folks, for the opportunity. If you have any questions, my email ID and my cell number is on the presentation, which you can obviously reach out to me anytime, either directly or through Kuntal. Absolutely fine with me. Thank you so much for
Thank
your
you so
time.
much,
Have a
Sridhar.
good day.
Thank you.
Bye
Have a
bye.
nice day. Thanks.